Hi folks, today is Wednesday, November 18th, and a few updates related to Thanksgiving and where we are with the COVID-19 virus. So right now in New Hampshire, the number of positive cases are skyrocketing, I think is the right term. You know, we were below 20 cases per day in early summertime. We're up to an average of about 335 cases per day now. And more importantly, the number of people, or the percentage of people who test positive has gone from a low of about 1% to now in our counties of Rockingham, Stratford, and Hillsborough, 5% or higher. So risks associated with that, exposure associated with that. At the same time that Thanksgiving is next week. And Thanksgiving, you know, we get together with family, we eat, we drink, we're merry, but maybe this year that's just not the best idea. So we have some guidelines related to Thanksgiving, and they are, number one, our biggest goal would be that you would stay home and let us cook your turkey dinner for you. Be a nice moist turkey and incredibly tasty stuffing, and we will deliver it to you, and you can watch football and the Macy's Day Parade, which is apparently still happening in some fashion, and just enjoy a very quiet day. That would be goal number one. If you choose to spend the day with family off-site, there are some guidelines. Certain actions will require you to quarantine, self-quarantine when you return. Number one, if you stay overnight, you'll need to self-quarantine. Number two, if you are at a gathering that is more than 6 people who are not part of your household, so your RiverWoods household or Birch Hill household, then you'll need to self-quarantine. If you're around anyone who traveled to Thanksgiving, even if it's a small gathering, if you're around someone who traveled and didn't quarantine prior or quarantined for 2 weeks when they got here, you'll need to self-quarantine. If you're around someone who traveled to that Thanksgiving event via public transportation, so you know, train, plane, bus, car share, like an Uber, you'll need to self-quarantine. Or if you're around, and, you know, any of the participants in your Thanksgiving day are college kids who are returning from school and haven't had a negative test in the last 3 days, then you'll need to self-quarantine. And these are, we will, that'll be a 7-day quarantine. And on the 7th day, we'll be able to administer a test for you. Generally, we get those results in 24 to 36 hours, could be 48 hours. And if you're test negative, then quarantine will be over. And this is all designed to keep our community safe. Many school systems are going remote for the week or two post Thanksgiving for just these same reasons. So that's where we are related to Thanksgiving, and I know that's a bummer because Thanksgiving is a really fun holiday for us to get together. But perhaps this year we can give thanks and have turkey in March or in April when we're a little bit more back to normal in the world. And this is the reality. We're getting there, you know. So we want to just hang in there and stay strong about this the next few months, because these Binax now test kits are coming. They're fast, reliable, and cheap tests that once we can get our hands on a bulk of them, it allows us to have more interaction in a safe way. And I'm sure you've been watching the news. There are 2 vaccines that are testing at 95% efficacy. That's fantastic. Our healthcare workers, our nurses and other direct care staff will be in the first sort of 1A wave of vaccine availability. We believe that will be either before the end of the year or right, you know, at the beginning of 2021. Also our long-term care residents, so folks who are in assisted living or memory support or nursing care, will be in that wave. And then we also believe that our independent living residents, because of age and the fact that we're living in communal setting, will be in either the 1A or 1B wave. So it's coming. The vaccine is coming. the ability to keep yourself safe is coming. And we need to hang in there for a couple more months. So that's sort of the message. And just want to end by saying, so Thanksgiving has always been my favorite holiday. This year I kind of hate it because it's just adding so much risk to our plate right now, with people just honestly, genuinely wanting to get together with their families. But here's what I would say to you. I want you to be there for your family for Thanksgiving, but also for Valentine's Day and St. Patrick's Day and Easter or Passover and Memorial Day and 4th of July and Flag Day and everything else that's coming. So we need to just hang in there for a little bit longer. Maybe it's an opportunity to not have to hang out with some family members you don't really like, but most likely it's a day that you'll be bummed, that we're missing out on some of the interactions that we really enjoy. But it's an investment in your safety, your health, and the safety of our communities. So science is coming, it's catching up, and we have to hang in there for a couple more months. Until then, wash your hands, stay 6 feet apart, wear your mask, and stay healthy, my friends.